Thank you for joining the AAKP National Patients Meeting. I'm Ed Hickey, Vice President of AAKP and Chair of the Veterans Health Initiative. I'm a former Marine Infantry officer and I'm an attorney in Los Angeles, California. I'm active in the Armed Forces legal community here in California and work with the Veterans Legal Service Project of the LA County Bar Association to support the legal needs of active duty military personnel, reservists, and veterans. I'm also a former senior aide on Capitol Hill and a former senior advisor to the Director of the United States Civil Service. Like many of you listening today, I have a history of kidney disease in my family and have direct experience as a caregiver. I'm also a kidney patient and share the same sense of urgency to impact research and innovation to save and improve lives and reduce suffering. In 2019, AAKP launched the Decade of the Kidney. Our stated goal and objective is to help deliver substantive changes in kidney research and innovations in the next 10 years. In order to do this, patients must be involved in both research and communications, and we need to share our insights and personal stories more widely. Over the past several years, AAKP patient advocates have been highly successful in getting their viewpoints published in peer-reviewed medical journals. By doing this, we are impacting the research and medical communities. A major factor in this success has been our friend and ally, Dr. Ranish Mahorda, editor-in-chief of the Clinical Journal of the American Society of Nephrology. Under his leadership, C. Jason launched a strategic initiative that established patient voice editors and patient voice editorials. Based on metrics that measure media and social media impact, the patient editorials appearing on C. Jason are among the most impactful that C. Jason has ever published. We thank Dr. Mahorda and his C. Jason team for elevating our voices across the kidney community. Beyond medical journal, AAKP patients and allies are also impacting public and policymaker perceptions about the role of patients in kidney science and innovation through published books. And that brings us to our panel today. The individuals you will listen to in this session are AAKP members, board members, and allied medical professionals who have used their talents and the power of the written word to author well-received books and forthcoming books. Their topics range from kidney science and learning to very personal and emotional stories about their direct experiences with kidney patients and kidney disease. Each of these authors has our deep respect for their intellectual honesty, courage, and sheer guts to get in the public arena and share their viewpoints. I hope those of you who are watching today are inspired by their example. I encourage everyone listening to try your own hand at writing and publishing. Whether you write a letter to the editor, a blog, an article for a medical journal, or a book, the time is now to tell your story during the Decade of the Kidney. For today's session, Authors Corner, AAKP patients and affiliates advancing care, research, and shared decision-making through published work. I have the honor of conducting a series of interviews that we are privileged to share with you now.
The title of the book is Staying Healthy with Kidney Disease, and that is the title describes the book. That's what it's about. It's actually about things that you can do to stay healthy with kidney disease if you have kidney disease, and if you don't have kidney disease, what you can do to try to prevent developing kidney disease. The reason I wrote this book was that there are 60 million people in America with with diabetes. There are 38 million people with kidney disease. There are 100 million people with high blood pressure, and 1/3 of the population is overweight. 76.4% of our population are baby boomers. And so that's a large audience. And yet there's a tremendous opportunity among those groups of people to make a difference in the quality of life and to either delay or prevent kidney disease should it exist or should it start. Well, I've been practicing nephrology since 1978, and many years ago, I myself became sick with a metastatic cancer that let me see the other side of healthcare, not the doctor side, but the patient side. And when I saw it from that viewpoint, it made me a lot more empathetic toward what patients go through. And I wanted to work harder to make, number one, make myself a better doctor, but number two, contribute more to our profession from a larger dimension. In the practice, I have seen a lot of new concepts develop. There are a lot of new therapies. The future for kidney disease is very, very bright. My big regret when I see patients now is that either I didn't see them earlier or that I wish I knew back when I first saw my patients what I know now. The thing is that's most important about kidney disease and about this book is that, number one, and this is the big observation that I've had on my journey with AAKP, which is integrated into this book, is that kidney patients don't necessarily feel bad. Things like hyperfiltration, mass disease progression, in other words, the markers of kidney disease may not tell us how bad the disease is progressing. And the second thing is that kidney disease progression isn't just prevented with taking pills. It's not just stopped with medications. It's a total commitment. It involves our whole lifestyle. It involves diet. It involves exercise. It involves staying away from cigarette smoking. It's a big job to try to stay healthy with kidney disease. So one of the things that I've learned with AAKP and that I've learned working on this book is that the paradigm for kidney disease has changed in the last several years. I've been involved with kidney disease since 1978, or even earlier, actually, since 1969. But I've been involved with AAKP for about 25 years. And the fact that we now have biomarkers and we have really sophisticated genetics, we're able to see that kidney disease starts very, very early in life, and that it's the early start that makes a difference. Treating inflammation, controlling hyperfiltration, reducing the consequences of the metabolic syndrome really is going to make a difference. And it's these advancing concepts that we are now understanding better and that we're now teaching that are really going to help us portray kidney disease in a much brighter way than we ever did. Probably the next question that I should answer is, why read this book? It's not hard to read, by the way. It's written in layman's terms. We made sure that a lot of the medicalese was out of it, that it's written in a very understandable fashion. And it explains kidney disease in simple terms. It lays the foundation for adopting the concepts that slow disease progression. It relates aging in the kidney to aging in the body. And its ideas and its takeaways will also help your family and your friends to remain healthy, even if they don't have kidney disease.
I hope these interviews inspired you as much as they did me. And if you have not yet had the opportunity to read these books, I encourage you to do so and keep a lookout for those coming soon.